Hello, I'm Danielle Vonfelt with Hayes Medical Center in Hayes, Kansas. We are going to go over some things you should know before your surgery. Prior to your arrival to the hospital the morning of your surgery, you will need to have an empty stomach, meaning nothing to eat or drink after midnight. This includes gum, hard candy, and chewing tobacco. Please brush your teeth and shower before arriving the morning of surgery. An individual from Hayes Med will have contacted you earlier in the week to instruct you on what medications to take prior to your arrival. These may be taken with a sip of water. Be sure to bring a driver over the age of 18 with you to bring you home after surgery. Upon arrival, please park in parking lot B and come into the hospital through the Miller Medical Pavilion entrance. You will then check in through admissions and you will be given directions to the surgical waiting room. After they weigh you and obtain some information, you will then be escorted to ambulatory surgery. Please arrive approximately 1.5 hours before your surgery start time so that you can be prepped for surgery and the physicians can see you prior to surgery. On occasion, emergency procedures arise or the procedure ahead of you take longer than expected and a delay can occur. Once you are taken to your pre-op room, you will change out of your street clothes and into a gown. This means removing all clothing, bra, and underwear included. You will also be asked to remove any jewelry, dentures, and glasses or contacts prior to your procedure. You will be provided with a pair of gripper socks to wear before, during, and after your procedures for your safety. Please wait to use the restroom until checked in to your pre-op room. In some instances, some surgeons request a urine sample upon arrival. If your physician has ordered this for you, your nurse will request a sample from you at this time. If you are unable to provide one, please communicate this with your nurse. Your nurse will verify that you have not had anything to eat or drink since midnight. This includes hard candy and/or gum. Your nurse will also verify if you have any allergies and if you take any medications routinely at home. This includes over-the-counter meds and supplements. If applicable, your physician may have requested for you to take medications with a sip of water prior to your arrival. An individual from Hayes Med will have contacted you earlier in the week to instruct you on what medications to take. Please let your nurse know which, if any, medications were taken the morning of your procedure. Your nurse will obtain a set of vital signs and start an IV. The IV will be used to give you IV fluid, anesthesia medications, and potentially pain medication and/or nausea medication if required. If you have any questions, please call Hayes Med One Call at 855-429-7633. Thank you.